The Integrated Neighbourhood Teams will do two things. They'll provide better joined up care for people who already have long-term chronic conditions, who are often getting care from lots of different parts of health and social care at the moment in a way that isn't working as well for them as it could. We also hope these teams will be able to concentrate on some of the early intervention work that can stop people in the areas they're responsible for developing those kinds of conditions.
If we bring together teams in a neighbourhood level, that's the best way to deliver healthcare. You bring together GPs, nurses, social care staff, the voluntary sector, all working together, providing seamless service. That way it makes it easier for the citizens to access a whole range of healthcare services.
We're bringing lots of different people with different expertise in the same place to share experiences and what works and what doesn't work to solve a patient's problem.
We recognise that often citizens have difficulty accessing healthcare, they're not quite sure where to go, they might feel they're going from pillar to post because the way that services are currently configured. We believe around this neighbourhood approach, we can make it easy for patients and their families to access the services without going around the mill.
We hope we will be able to provide better care for the people we are here to care, and that they will experience a more joined up service offer that helps keep them healthy. That means we can use our resources better, so we will free up the time of our clinicians, the nurses, the doctors, the therapists working in this space to concentrate on the people who need them most. And we will hope we will be able to get ahead and start putting some proper investment into that early intervention and prevention work, which has been so difficult to get to when all the attention's concentrated where it often is at the moment.
Each PCN will be aligned to an integrated neighbourhood team that's working in the way that we envisage. This will be about helping manage the health and well-being of their local residents and allow our services and teams to be more joined up and integrated around that PCN footprint.
Well, the way that we've been established as an integrated care board, at the heart of our delivery is health inequalities and prevention. We want to move away from just being reactive to healthcare.
Proactive, preventative support in the community is important for Birmingham and the wider system really, for a number of reasons. Clearly we've got the ever-increasing demand both on health and social care, an ageing population. COVID also kind of shone a light clearly on the vast inequities across different parts of our society. I think it's really, really important that we start to try to tackle that, not at a system or a kind of place level, but we really need to get down to that neighbourhood level, a 30 to 50,000 population, so we can understand the communities within that within that kind of sphere.
We have to provide our teams with the data they need. It's been fundamental to how we've developed the programme so far and how we want our teams to work differently.
The way that we are trying to use our workforce differently within integrated neighbourhood teams is to really look at how we can shift our kind of clinical, social, voluntary sector staff to start looking at more preventative interactions. So how do we look at an individual or a cohort of our kind of neighbourhood population and start to try to support them at a much earlier part of their kind of journey within the health and care social system.
There is a lot of work being put into preventative pathways. If we can stop it from happening, then it's absolutely going to make a difference to citizens' outcome.
So the holistic approach is important because we can't take patients just being their condition, they're a human being as well. So if you deal with the social, psychological aspects, even financial aspects that they suffer, you're going to get a happier patient.
The best thing about the programme is actually coming together as an MDT, meeting once a week, and the discussions that we have and the holistic conversations that we're able to generate from it, and the interventions and warm handovers and pathways that we're actually using to support citizens at the end is really exciting.
From residents, I've heard that they feel that it's really helpful. So some feedback that I've had personally is, oh, nobody's asked me this before. Oh, I didn't even know this service was available. Those sorts of things.
So the word I'd use to describe this Integrated Neighbourhood Teams programme is exciting, because I think it genuinely gives us that chance to make a fundamental difference to people for the long term.
Transformative.
Exciting.
Transformational.